Hi, everyone. Thank you so much for tuning into this talk. My name is Chandler Swope. I'm a youth social work, and I've worked with the Huntington's disease community for about the last 7 years. I'm here today to talk a little bit about how do we support young people when it comes to the genetic testing process, particularly pre-symptomatic testing. It can be a really difficult conversation. I think the attitudes about testing are changing a little bit across generations, and it's such a personal decision that not everyone in the family sees eye to eye on. And it can be really, really difficult to talk about either with your child or with another family member or with a loved one, that you're connected to. So hopefully what we'll cover today is some just one where we're at with testing, but also ways that we can support the young people in our lives. So really what when we talk about young people, when it comes to the HD community, you see this across the globe, is we're looking at anyone under the age of 35. So we know that traditionally we hear numbers about only 10 to 15% of people decide to get pre-symptomatically genetically tested for Huntington's disease. And that can happen after they turn 18, according to the genetic testing guidelines. But what we do see is that when it comes to things moving forward or looking at timelines, somebody is still considered a young person for in many ways, until that age of 35, or at least, depending on the situation, until their mid to late 20s, early 30s. So we know that people have their chronological age, but there's also something that I refer to as their HD age. And that's really dependent on when HD came into their lives and really how much exposure they've had to it. So, I've worked with young people where they've known about HD since they sort of had active memory. They've lived with multiple loved ones or have seen multiple loved ones take their journey with HD. It's something that was maybe openly and readily discussed in the family. And then other families where HD is brand new to them into their mid or late 20s. And that can be because all kinds of situations. Families didn't talk about it. There were family secrets. They were adopted. It was unknown before for their family history. And for them, their HD age and their chronological age may be very different, especially when we think about when somebody could be ready to test or when somebody begins thinking about engaging in that genetic testing process. So that's something to keep in mind that we often say, oh, well, you're only 18. Are you sure you're ready to make this decision? But somebody who's 18 who has lived with HD as part of their daily existence for maybe 12 years, may be in a different place and may be ready to enter into the process of genetic testing versus someone who just learned about HD but maybe 30 years old. We also need to think about what are the motivations for testing. And I think that's the biggest piece of work around, or biggest piece of conversation that I think should happen with young people. And that's where I really rely on genetic counseling. So making sure that young people are not just accessing some doctor in the community, although I know they trust their primary care or possibly trust their family doctor, but also integrating that into an HD specialty team or at least a genetic counselor who has some experience with Huntington's disease. Because I think the conversations that a genetic counselor would have are different than the conversations I would have, are different the conversations that a family physician would have. Maybe they have a therapist in the community or even their own family members. So I think it's really important to make sure that the young people or that anyone really engaging in genetic testing has ample opportunities to have conversations about why testing, why now, because I think it is very important. What we're seeing, or at least again, a lot of this is from just what I've experienced working in the community for the last 7 years, is this generation in particular is very information seeking. They have pretty much never had a time in their lives where information wasn't at their fingertips. So, they've always had a smartphone in hand. They've never had to sort of wait to gather information. So even the notion of waiting to get some big piece of information is pretty foreign to them and hasn't been part of their existence. And we need to acknowledge that and recognize that that's just the reality of their existence versus maybe when I was growing up and there was not internet always, or dial-up internet, or I had to go to an actual library to look stuff up. And we definitely didn't have smartphones. I grew up knowing that sometimes you got to wait that sometimes you weren't readily going to get the information that you needed, that you couldn't always contact somebody at the drop of a hat. And so again, that's just something we need to acknowledge, because if you are a parent of a young person, your experience is very different, and we need to keep that in our lens as we are working with young people through these conversations. I also think, because of where we're at with the education and information around HD, young people are very much future thinking. So not necessarily, I think a lot of parents think it's very fatalistic future thinking, that if they find out that they do carry the HD gene, that they will actually lose motivation. But I think what we're seeing is, especially young people who have the right supports, who have access to correct factual information, who feel that they can talk about the things that concern them with HD, they really just want to navigate their life with HD instead of despite HD. And I think that's a really important distinction, that making decisions because they know they carry the gene, but still living a fulfilling life isn't the same as making decisions solely based on the fact that they have HD. I think many young people, again, going back to what we were just discussing, who have known about HD, this is something they've had plenty of time to build into their scope of consciousness. And so it's really important to remember that just because they say, well, if I find out that I carry the gene, then I'm going to make this decision, doesn't mean that they won't be happy or fulfilled with those decisions or that life path that they choose. And I also think with the advances in technology in terms of fertility treatments, that's also something young people think about, that they can have a family and they want to know early on so they can make the decisions that are best for their family when it comes to family planning. Because again, when we talk about young people and we talk about up to the age of 35, some of these young people are making family planning decisions. And I think that there's also this hope for future treatments. I know recently there was some pretty devastating news for the community, but despite that news, I think there's still a lot of hope for the future. There are more companies working on things than ever before, and young people want to be a part of the solution. They are itching to get into trials, and for many of them, they do need to have, they will get tested anyway. And so at least they can control the testing process on their terms this way. It is something I always engage in conversation around, especially if they're 21. And some of these trials, particularly for disease modifying trials, they not only need to be of a certain age, but they need to be experiencing symptoms. So if that's their main motivation, is now the best time, or can they wait because there's other major things going on in their lives? And then of course there's the notion of they've turned 18, they now have the ability to make that decision and they're ready to test. And again, that conversation needs to be had with every individual. I think it's a knee-jerk reaction to want to protect your young people. I think it's a knee-jerk reaction even sometimes to think that an 18-year-old cannot handle this information. But again, each individual, what their experience with HD really helps them define what they can and cannot handle and what they do with that information. And so sometimes I think from the outside, and probably the adult in us or the caretaker in us says, well, don't just do it because you can, make sure you're really ready. But for some young people who have known about HD their whole life, this is something they've been thinking about for years. I think if you talk to any young person or any person in the HD community, as soon as they find out they're at risk, the question of whether or not they have it or whether or not to test is always somewhere in their mind. Whether or not it's at the forefront is not always the case, but it's important to know that this is something that they think about pretty consistently. And then, you know, again, when we think about young people in testing, we really need to find out what is their motivation, making sure that it's their decision, that it's something they've thought about, that they've decided how it will impact or if it'll impact their life or their decision making, and what those reasons are, and not trying to dissuade them, as I think many people sort of have that reaction to want to do, because it is such a big piece of information. And once you know it, you can't take it back, but really helping them engage in that process of um, critically thinking about this and what does it mean for their lives, and really critically thinking about it from all sides of the question. And I think that's where it's critically important to have open, honest communication and make sure that your young people, your loved ones, know that they can come to you with questions or concerns or just to talk about this, because it sometimes I think there's a fear of talking about it, or it's too hard a conversation, and absolutely it is. But knowing that you're open to it and that they have support and that they can engage in that discussion with you or someone else that they trust is really critically important. And then again, really understand their motivations for information seeking. What we do know is getting that pre-symptomatic test or getting a genetic test tells you yes or no, but it doesn't tell you when. It doesn't tell you what your symptoms will look like. It doesn't tell you how your experience with HD will be, and really exploring that with anyone engaging in the testing process. Are they ready for something to be known, but possibly more unknowns? Do they think they will be consumed by symptom hunting? Do they think it will color all those future decisions like we discussed? So I think it's just really important. Again, what are you seeking to find out? A lot of times just engaging in the testing process answers a lot of questions, and maybe they still go through with the blood draw and the results, but maybe they got enough information to say, you know what, I still do want to know at some point, but now is not quite the right time. And then again, making sure that we have a really safe place to discuss HD. And whether that's in the home, with a care team, with a counselor in the community who has some understanding of HD, or even with, again, trusted family supports. Every family looks different about who supports them in all of this. And so making sure that there is some open line of communication. And, as a parent, it may be really hard for you to discuss, and acknowledging that, but letting your kids know that you understand that they do need to talk about it, that you're willing to try, or at least make sure that they get the right supports, because it's not an easy conversation to have. And then again, we need to think about developmentally where young people are. Again, it's different if they're 18 versus 27. What stage of development are they in? What does that sort of mean for the impact of their lives, about when they get it? And we know that young people need to feel like they have some agency in this decision. I think traditionally, just in our healthcare system in general, no matter who the patient is, we sort of say, well, the doctors know best and we're just supposed to listen. But I think where we're hopefully going with some of this is that it's a partnership, that we're working together with our care providers. I know I see that in the HD clinics all the time, and making sure that young people feel like they have a space to have this conversation, that they're with an audience, so that care team is really listening to them, and that they have a voice and some influence in this decision making process, no matter what age. And sometimes it's just how we phrase questions. Sometimes it's just prefacing things with, I'm not trying to change your mind, but have you thought about? So really playing devil's advocate, but making sure that we remember where someone is developmentally, that if they're 19, 20 years old, they may be very defensive. And that's just sort of a natural developmental stage of mistrusting the systems and still not being sure that somebody is really there for them, or that this care team is really on their side, especially if they are the same care team that work with their family. It can still feel like, yes, I know there's HIPAA, yes, I know there's protections, but is it really? And so really assuring them that the conversations that you have, particularly if the family, maybe you as parents aren't quite ready to engage in the process, but they decide to go, ensuring, having, if you're a care provider, ensuring them that it is a safe place, and that that information is just between the two of you. And for families, again, I can only imagine how tough this decision is. But again, if you're not ready to have the conversation, making sure that your young people have a safe place to have that. And then again, I think, how do we empower young people? And I think the biggest thing is information here, making sure that they have access to the right information, making sure that they know where the resources are through the community, through HD Reach, and all the other amazing nonprofits, HDSA, HDO, all the different things about where they can get support, whether it's support groups, information, the actual test, what that means. Have they thought about insurance? Have they thought about all those things that we generally don't always think about until somebody asks us. I always tell them to think of it like a job interview. Somebody's going to ask, do you have any more questions? And they'll say no, but they will as soon as they leave the door. And that's also how I bring up why the process takes so long, because it is so much information to digest that sometimes it can feel like you don't have any questions, but it's only because you're so overwhelmed. And so the reason that there's time before the blood draw, the reason that there's time between appointments is to make sure that nothing comes up um, in that time, that you're fully prepared to make the decision that you're going to make. And then again, making sure that they are shared decision makers in this process, that even if there are some hesitations on your part as a loved one, that they do really feel like they have their voice heard, that they're being able to make decisions for their lives. We tell them they become an adult at 18, and we know that maybe as adults we weren't all quite adults at 18, but acknowledging that they do have some decision making power in their lives at this point, and really hearing them and listening to them, and not putting our own beliefs or fears or doubts or concerns onto them, but really having open, honest discussions. I think we are seeing an uptick in testing because of options, because of just where this current generation is. And so this is something that I think families are engaging in more and more. And I think knowledge is power. Healthy communication around the topic is empowering for young people. And again, I think making sure that everyone has the right supports. There are tons of resources. If you know somebody's seen a counselor in the community who doesn't know about HD, there are resources to make sure that you as the family don't have to be the educator, that you can just go to counseling to get support versus also providing the education. And so I think the biggest tips to take away here are: listen, really open your mind, open your heart, and listen to what your young person is saying to you, what their needs are, what their motivations are, why they want to do this right now. I think it's very easy, that protective factor we have for young people, particularly if they're your child, to say, I just want to protect you. And part of that is not knowing the scary piece of information. I know it's talked about a lot in this community about why sometimes families wait to tell young people. And I think this conversation is somewhat similar. So really trying to open those lines of communication, that even if they're not coming to you yet, say when they're ready, that you're there for them. And if you're not ready quite yet to have that conversation, to make sure that you provide the resources, that you empower them to go through the process and get the information that they need, get the support that they need. Because I think it is so critically important to go through the process, to make sure that they know where to get support, to make sure that they can get the right information. So, I the big thing is just open, honest communication. And if there are supports that you need some help about how to have these difficult conversations, please make sure you contact HD Reach, so they can help provide some extra resources on going through the genetic testing process. I hope that I was able to provide some insights and education, and I look forward to hearing the feedback. And I hope that if you have to have this conversation, that you guys band together as a family and support each other. And thank you so much for taking the time to listen to this. I appreciate it. Goodbye.